Hello, and welcome to It's All About Your Health, Straight Talk with Dr. Nancy. My name is Nancy Greer-Williams, and I am a health researcher for the University of Arkansas for Medical Sciences.
Diabetes is a disorder of glucose metabolism that results from the body's inability to produce or to use insulin effectively. There are two different types of diabetes mainly. Type 1 diabetes was previously referred to as juvenile diabetes because you see it mostly in children and young adults. Type 2 diabetes we used to only see in adults. However, now with the prevalence of childhood obesity, we're seeing a lot of type 2 diabetes in children. The symptoms of diabetes are frequent thirst, frequent urination, increased hunger, also symptoms of fatigue and lethargy. Unexplained weight loss can also be a sign of diabetes. It's important that you go in to be evaluated for possible diabetes because if there are symptoms that you're having, you may be pre-diabetic, and there are measures that can be taken at that point to prevent you from crossing over to become a diabetic at that point. To be treated for diabetes, you would need to be seen by a primary care physician, and that could be at a private office or at a community health center in your local area. They can do blood tests to determine what your blood sugar level is. They could do other blood tests to make sure that you haven't had any complications that result from you having undiagnosed diabetes for a long period of time. There are several obstacles that prevent patients from being treated for their diabetes. There may be a fear of medical personnel is one. The other thing may be lack of funding. Patients may feel that they don't have options because they don't have medical insurance. Patients need to know that there are options available to them at a local health department, at a local community health center, that they can provide them with information that they need to get the proper treatment, to make the lifestyle changes that they need to also treat their diabetes, and also get medications that they would otherwise be unable to afford. Some of the complications of diabetes are neuropathy or nerve damage that can cause a lot of pain in the legs as you're trying to walk. Other complications include retinopathy or damage to the eyes, and that can cause vision loss. Other complications can lead to heart attack and stroke from diabetes. The first way that we try to manage diabetes is to do lifestyle changes, diet, and increasing physical activity. And frequently, this is all that's needed to lower the blood sugar to where it's unlikely to cause complications. Secondly, the patient may need to be put on medications. People hear diabetes and they frequently think insulin is going to be necessary, but that's not always the case. Patients can be controlled on medications that they can take by mouth, and monitoring their diet and getting physical activity may be all that they need to control their diabetes. A person can decrease the chance that they'll develop diabetes by increasing their activity level and changing the way that they consume foods, the type of foods that they consume. Eating a diet that's high in fruits and vegetables is always a good option to try to manage or decrease the likelihood they won't develop diabetes. The other thing people need to do is to know their family history, because frequently people are at risk for diabetes because they have a family history of diabetes. So it's important that they talk with their family members and know what their history is. Undiagnosed or uncontrolled diabetes can lead to several long-term complications. Increased blood sugar can cause damage to the blood vessels, and our blood vessels supply all the organs of our body, so the complications from diabetes can affect nearly every organ in our body. Particularly the kidneys it's one of the leading causes of renal failure, and that we treat today is uncontrolled diabetes. Damage to the blood vessels can lead to stroke, heart disease, can lead to nerve damage, which causes neuropathy. And that can be a very disabling condition that some diabetics face from poorly controlled diabetes. The exercise can be something as simple as walking with intent. I tell patients to walk as though you have somewhere that you have to be in a hurry, not like you're strolling through the park. Okay. You want to exercise to the point where you get your heart rate up. So you want to stress yourself and get your calories up and get your muscles moving. When you use your muscles, they pull the blood sugar, they pull the glucose from the blood to the muscles, thereby decreasing the blood sugar level. When it comes to exercise, patients need to try to reach a goal of 30 minutes 5 times a week. In diabetes, the biggest change in the diet is going to be portion control and an increase in the amount of vegetables, fruits and vegetables that are contained in the diet. Unfortunately, people get an idea that they're no longer ever going to have anything sweet. They're no longer going to be able to have anything sweet in their diet when they're diagnosed with diabetes, and that's simply not so. They have to be able to maintain moderation in their diet, but decreased portion sizes along with increased activity, along with whatever medications that your medical provider has recommended for you, can be very effective in controlling your diabetes. Other ways they need to control their diet is to monitor the amount of fats and salt that they get in their diet. Diabetes has a close association with other diseases such as hypertension and high cholesterol. So maintaining these levels at acceptable rates can decrease the chance that their diabetes is going to be out of control. Once someone is diagnosed with diabetes, it's thought that they will be diabetic for the rest of their lives. However, patients can make the necessary changes in their lifestyle where they can manage their diabetes without medication being required. Weight loss, increased activity, healthy diet can all contribute to a patient not requiring medication to control their diabetes. Diabetes is thought to be a genetic disorder. You're born with a gene that predisposes you to have diabetes, but your environment is what triggers that gene to go on, and you go on to develop diabetes. So you'll always have the predisposition to be diabetic, but you can control your environment so you can down-regulate or turn off that gene so it doesn't express itself. There are some symptoms for diabetes, but frequently diabetes can be asymptomatic in early stages. That's why it is crucial that you see your primary care physician or your local community health center provider so they can run the tests that need to be run to determine if you are at risk for diabetes. There are blood tests that can be done they can do on site to tell you what your immediate blood sugar level is. There's another test, hemoglobin A1C is the test that we use to monitor diabetes, but it's also being used now as screening patients that may have risk factors for diabetes. If you have a family history of diabetes, if you know you're overweight, if you know you're not eating properly, if you know that you're not getting the physical activity that you should be getting, it's important that you see your doctor and see what your risk factors are, or to see if you've even developed diabetes and it just hasn't been diagnosed yet.
Thanks for watching. Our goal for this program is to give you good information that you can trust on health topics that you can use for you and your family to live a long, healthy life. If there is something in this message you want to know more about and you live in the state of Arkansas, take a moment to talk with one of our health experts at your local area health education center.